So today we are going to talk about an interesting topic called as shin splint. Now, shin splint is an overuse stress injuries which happens normally to people who run a lot or people who are standing as well. So the main symptoms what you're going to feel is pain around the medial or the lateral aspect of the tibia, and normally the pain subsides when you're not doing any activity or at rest, or it is increased when you're doing a lot of walking or running, or you will feel a dull or sharp pain shooting around the tibia as well. So these are the two symptoms which normally people feel with shin splint. So in terms of treatment, there are three probable treatments which we do normally. First one and the first and the foremost thing which we're going to do is reduce the pain and inflammation at the site of the injury, which is the tibia on the lateral aspect or on the medial aspect. So we're going to use a machine called as BEST. It's going to reduce the pain and inflammation on the side by increasing the ATP, which is also known as adenotriphosphate. The second would be strengthening the weak muscles as well as stretch the tight muscles. So normally the weak or the tight muscles would be your calf muscles. We also strengthen the tibialis anterior as well as your glutes. So whenever we are taking into strength aspect, we have to make sure that we are strengthening the entire limb, not just one particular muscle. We're just going to apply a medium. So we're going to use a cream around this area, and we're going to use these two probes to work around the muscle. So in this way, we are not only just reducing pain and inflammation, we are kind of doing a manual work with the probe as well. And we have different programs. So I mean, there are around 100 to 120 programs in the machine. So each and specific condition, we have a program for it. Once we finish this, we are gonna do a bit of a dry needling session where we are inserting a small thin needle into the muscle. Now, when we insert a needle, what happens is that we are causing micro trauma to that particular muscle. When we do that, we are causing micro trauma to the muscle where we have inserted the needle. Now, once that happens, your immune system basically kicks in and it's going to send fresh oxygenated blood to that particular area to heal it much faster. Okay, so the third and the most important part would be the exercise part as well as stretching. So we're going to start with the stretch aspect, and we're going to stretch the calf muscles. So the patient would be lying in a supine position or lying on his back. All we have to do is put the band on the ankle, and the other end would be with the patient. Now, all we have to tell the patient to inhale as well as exhale. So whenever you're doing, you're pulling the ankle towards, inhale and exhale. Okay, again, do it. Yes. So you're going to maintain the stretch for around 10 to 15 seconds, and you can do around 2 to 3 sets. Relax. So this is one exercise. The second exercise would be the strengthening, where we are strengthening the tibialis anterior. You can use a band or a TheraBand like this. Start with the minimum weight. Okay, all you have to do is take your ankle towards yourself, and I'm going to apply a little resistance with the TheraBand. Okay, do it. Yes. Make sure you're not moving your knee. The pure movement should be ankle up and outwards. So make sure you're doing this without the knee movement. Yes. Again, you're going to do 10 to 15 reps, 2 to 3 sets. And the third and the final exercise would be patient again lying down on his back, one leg bent to 90 degrees. The second leg, the patient is going to lift up with ankle up or dorsiflexion, and try to take your buttocks up with both the hands down. Okay, so again, go down slow, all the way down and up. Very good. Yes. Good. Again, 10 to 15 reps, 2 sets.